They decided to admit me and decided that it was time to give birth. So I was admitted to hospital, and this was something that I was expecting. So our maternal fetal medicine specialist had actually told me that he wanted to deliver me at 32 weeks. It becomes harder to treat at 32 weeks and beyond. I was admitted, and then I waited around for a bed. Now I was waiting for a really long time, and then a doctor came and told us that there were no NICU or special care beds, and unfortunately they wouldn't be able to accommodate birth in the next couple of days as our doctor had wanted to do. So I was told to go to the Mater. Glenn Gardner actually called me, and he told me to come the next day and have a scan. So they booked me in. We went up, and it became a very different discussion than what I thought it was going to be. So we were expecting them to say, you're going to be admitted to the Mater and we're going to give birth to these babies in the next couple of days. That was not the case. So after scanning me, they said, look, it's not urgent. Let's see if we can hold on to the babies for a little bit longer. So we think that we should try another in utero transfusion and at least buy some more time in the womb. I did not want to do another in utero transfusion. I was ready to say no. At that point, I was really over the pregnancy. It was so complicated. I was in hospital every few days. I was instructed to go to the hospital at the drop of a hat if I just felt even the smallest thing was amiss because of how high risk I was. I was over the pregnancy. I was in a lot of pain. I had a lot of pelvic girdle pain. I was unable to walk practically because of how much pain there was, and I couldn't do anything. Physio wasn't working, osteopath wasn't working. Tubie grip, belly bands, the whole thing, and I had such extreme reflux. So I know it's a little bit selfish, and I do see this time and time again, but I was just ready for them to come out, and I was ready for them to be off the placenta. The fact that the placenta wasn't doing them any favours was another consideration for me in wanting to birth them. But we went along with what Glenn Gardner's recommendation was, and we believed in him. So we thought that he knew exactly what he was doing and kind of wouldn't lead us astray. So we said yes. So the next day, I was admitted to hospital. Now this time they decided to do the in utero transfusion in theatre with an epidural. So that way they could change to a C-section immediately in theatre if they needed to, if the babies became distressed. Now, it's highly risky to do any fetal therapy on twins at 32 weeks. I'm not sure how often that's been done, but I found out later that I was only the second set of twins that Glenn Gardner had actually treated with an in utero transfusion and partial exchange transfusion. So I was admitted to hospital and prepared as if I was going to theatre, like a normal operation, which I guess it was. I was extremely scared, and the procedure was extremely late. So I believe that it was supposed to start at 4. So I was waiting around all day, having fasted, and I was hangry, I was emotional, I was crying every couple of minutes because it was so scary. Yeah, so the procedure started, I think, at 5 o'clock or something like that. So it was an hour over, and it went for a couple of hours. Now, it was slightly different this time. The great thing about being in theatre was that I was able to play my own music. So they asked me what music I wanted, and I asked them to play Michael Jackson, which was really great. And it sparked some conversations, which was nice and distracting. Unfortunately, my husband couldn't be there. Yeah, so I was alone, but the doctors were fantastic. So I had a couple of midwives, an anaesthetist, I had an anaesthetic nurse. There are a few other people in there just in case we had to birth the babies. It was extremely busy. It's hard to remember because I was quite overwhelmed with that one. Anyway, so I was still able to see everything on ultrasound, and it was done exactly the same way as before. The only change was that they started with Billy. So they started with the polycythemic baby and did the partial exchange first. Again, they had to abort the procedure early with her because she was actually coming over to investigate and play with instruments. Now, they do have the option to actually sedate the babies, but it's not preferable, and I certainly didn't want that if they could help it. So they cut short the partial exchange to Billy, but she did get what she needed. And then they moved on to Poppy. She wasn't nearly as anemic as before, so they needed to only transfuse about half the amount of blood as the previous time, which was really great news. It meant that the procedure before had real effect. So it was really, really good news. And she was done really quickly. And after that, I was sent into recovery. Now, recovery was really, really horrible. I won't go through that. But because it was late on a Friday night, everything just took really long. I also had contractions, so they left me in the birth suite for quite a bit longer than I would have liked. After a couple of hours in recovery, I was able to go up to the ward and try and get a good night's sleep. And I had a scan really early the next day. So Glenn had actually come in on a Saturday to scan me. And the numbers were really good and they sent me home really quickly. I will say with the procedure, the difference was if I was contracting, I didn't feel anything because I had an epidural. So it actually allowed them to work quicker than the first time, and I didn't feel anything. So it was absolutely fantastic in that regard. After Glenn sent me home, he just said, it could be any day that you give birth, but I'll be happy if I buy even one extra day in the womb for your girls. But what would be amazing is if we could get you to 34 weeks. That would be the ideal situation, but we'll see how you go. So off I went home and I just tried to enjoy the next couple of weeks, even as hard as it was. So I just kind of went about everything as normal and didn't kind of wait around for, I guess, labour to happen. I knew my babies were safe, so that was the main thing. That procedure did buy us an extra almost 2 weeks in the womb. So that procedure was done at 32 and 1, and my waters broke at 33 and 2. But I didn't give birth until 33 and 6. So overall, it did actually buy us a decent amount of time for the girls to grow. So I won't talk about the birth here, but you can see some of that story if you go back to my first video about my pregnancy and birth story. Thank you so much for watching. I really appreciate your support. Please like, subscribe, share. I'd love to get this information out in the world. I couldn't find anything like it when I looked for it. Like, nobody is talking about this procedure at all. And it's just one of those things where it is really hard to talk about it when you've gone through it. Yeah, I hope you enjoyed this video and I'll see you at the next one.